Welcome to Here to Serve, a United Regional podcast. I'm your host, Ryan Graves. My favorite part of being the Director of Patient Experience at United Regional is the incredible people that I meet and work with on a daily basis, and I want you to meet them too. Join us to meet the people behind the badge and to highlight those who are here to serve. Shelley, welcome to the Here to Serve podcast.
Thanks for having me.
I'm excited to have you today. Looking forward to covering a lot of ground, but first, tell me about what your role is at United Regional.
Okay, so I serve as a Senior Director of Quality and Safety for the hospital and for our clinics. And that includes all kinds of things, working closely with all of our team members, of physicians, all the things regulatory, performance improvement, encompasses a whole lot of different moving parts of the hospital and the clinics.
It certainly does. It's a huge job. And I get stressed out thinking about all the things that you guys keep up with and the regulatory things and just the day to day. How long have you been at United Regional? How many years?
So I started in 1990, so I'm starting my 36th year.
36 year. We won't ask you what age you started at, we won't even do that math. But 36, coming up on 36?
Yeah.
Okay, that's incredible. Now, were you at General?
Yes.
General, you started at General. Okay.
Mm-hmm. I was a respiratory care student.
Respiratory care student is where you started at General. Mm-hmm. And so your first career path in healthcare was respiratory therapy, right?
Yep.
How long did you do that?
About 15 years I was in the respiratory department. I did various different roles, served as the director, and then after that went into some case management and performance improvement and quality. So in wound care, lots of things.
Okay.
36 years is a long time. I've had the opportunity to do many different things.
Well, I've never asked you this. I've always been curious, and I thought today would be a good day to ask you, how did you end up from respiratory, frontline staff respiratory therapy to quality? How did that go?
So I was in a meeting. We were looking at data, and we had some opportunity for improvement. Our data didn't look great with some processes and some outcomes. So I asked a question, and I had some suggestions what I thought we could try. And from that day forward, that was my first step onto the performance improvement path, and just have continued to grow from there. And I really like the opportunity to work with lots of different people and to make things better for our patients and for our staff. It's about everyone that walks in our facility. So that started it. Again, I love the patient care piece of it, but I had another opportunity that I felt was to make a greater impact by being part of the performance improvement projects that we have in our.
That's incredible. It doesn't surprise me at all from what I know about you. That tracks perfectly. I mean, at this point, I would say Shelley Moser is process improvement. Like, you believe it, you bleed it, you care about it, and it kind of infuses everything you do. I would say something that's, and I'm playing this scenario. I'd never asked you this question before, so it was interesting. I can totally see this playing out. In a meeting, you going, "Hey, I have this suggestion," and a wise leader would go, "Hey, that's somebody that that cares about this. This person just gave us a legit answer. They care about it." Which, by the way, for anybody out there, if you're in a meeting and you speak up, this is one of the dangers of speaking up, is you may have just volunteered. But anyways.
I remember where I was sitting. Like, I can tell you the room, the chair, because that started a
fork in the road for you.
Yeah, it was.
Well, I'm so glad you did, because, you make such an impact at United Regional, for our patients, for our team, and just I feel very blessed to have you in the role that you're in. Some people just fit their role, and you're an interesting blend. I think, from working with you all these years, there's a lot of people that are very, very process focused, and they just love the process, right? Those people can easily get focused on a process and not care about the people. Right. And then there's a flip side. There's a lot of folks that are very people oriented. I tend to be more people oriented. And I lack on the process side of things sometimes. And so you're one of the people that I think is so great at being able to do both. You're very process focused, but you also care about the people. The people is what makes the process work. And so you do both of those things well. The people that work for you, you can see it in the culture that they know that you care about them and you have their back, but you also, like, we gotta make these better. We have to improve. And so it seems like, I've never been in a meeting with you where you said, "Oh, guys, I don't know if we're going to be able to do this. I don't know if we're going to make this better." You seem very passionate about that. What kind of drives you to continue to always want to improve and get better?
So I think it's several things. the hospital and the clinics are very personal to me. This is where my family receives care. So that's it. And myself, I also receive care there too. But several years ago, which has been I think 15 years ago, my daughter came to work at the hospital. And so she is at the time was a direct bedside care. She's a nurse. And so like, how can I make sure it's very good for her, like the best, not just her, but any nurse. It just gives you a different perspective, because I would hear from her when she was in school, like, here's the things that we're doing. Like, oh, well, some of that really doesn't make sense. Like, let's see how we can change some processes. So that was kind of a full circle moment for me when my daughter came to work at the hospital. Yeah. So hearing her perspective from the bedside, because I'd been away from the bedside for quite some time. So that just, I've lived in Wichita Falls my entire life. When people say you need to give your introduction, not only have I worked here 36 years, I was born in the building.
Wow.
So it's really personal to me. I do have a lot of pride that I'm able to serve in the role that I am and be part of the United Regional. So I just want it to be the best it can be for our staff, our patients, and our providers.
Yeah, talk about buy-in. This is a weird phrase, but you can't buy-in. Like, I don't know, you can't pay for that. I don't know how to get any more bought in than you, Shelley. You're born in the building.
Yep.
It's a family affair. Your family works here. This is where you come for care. Like, and I think that is one of the things that's a strength for our organization is you're not alone in that. There are many people that like, hey, I was born and raised here. This is my community. This is my organization. This is where my mom comes. And so that's a powerful thing and definitely a motivator.
We all care a lot.
No doubt about it. Well, let me ask you this, switching gears just a little bit, something that's new, and you guys, gosh, we could do multiple episodes just on the amount of things you guys are working on any given day. But I want to hone in for a few minutes on something that's new for you and for me, and quite new to the organization as well, and that is our Patient Family Advisory Council. It's something that's different for our quality department that we haven't done before. So you've been very passionate about this, very excited to get it started. You and I have been able to work on this together a little bit. Tell me about what is a Patient Family Advisory Council, and where did it come from?
So a lot of healthcare organizations work with patient family councils. What they do is they bring as close as possible to you what their true experiences are. As you know, we do surveys. We survey, we act upon the surveys, but it's more three-dimensional when you're sitting in the committee room with the Patient Family Advisory Council. The majority of these folks on this council have either been patients or had a family member that's been a patient through one of our clinic services, through the emergency department, or an inpatient. So they're able to give us like real life experiences that are current. So they can tell us things like how the check-in process and if it's easy, about wait times. They can tell, and not that other people don't tell us these things, but they bring solutions. Mm-hmm. They like the performance improvement too, which is awesome. There's so many just small things we've been able to change, and several things that we're working on now is MyChart is a great tool if you know how to use it. Mm-hmm. And so we've done one educational session, and we're going to do another. Our goal with that group is to educate them, and then they can go out and educate people within their neighborhoods, in their churches, the communities, and the people that they're close to. Just kind of a ripple effect, I guess. We have a lot of resources for education, but we've got to get them out into the community. So this group is helping us take things back to the community. But they have been, it's better than I ever thought it would be. I mean, I knew it was going to be good, but I didn't know it was going to be this good. Each and every member, I feel like, is like it was their time to be on this committee. And one of our members, which we need to bring back sometime to talk to you on the podcast, Gloria, I want to give her all the credit for the very first meeting. She said, we are going to sit down like we're at our kitchen table. This is family dinner time, and we're going to talk about what's good, what's bad, what we need to improve, and we're all going to work on it together. It's not about blame. It's about working together to make this healthcare in our entire community better. So that was pretty cool.
Yeah, it's been a really cool experience. I'm with you. I knew it was going to be helpful, but I had no idea the extent of how powerful it would be. And a couple of things you said that I think were really good points is you read a comment, or you read a letter, or even a phone call. Those are all meaningful, but it's very different when you sit down across from these folks in a room and have a 3D conversation with them. And it's so helpful. And you did something that I think was really, really powerful, is that you were really selective and put some time and effort into recruitment of recruiting the right people. We didn't want people that were just going to be, for lack of a better term, like a yes man, just like,
Right, like cheerleaders.
cheerleaders. You guys are awesome. Well, we didn't want that. But we also didn't want people that were just going to be trying to just tear everything down. We wanted folks to tell us the truth, be invested in us getting better, do this with us. We want to listen. We'll have the humility to listen. And I think that's something I just would want to maybe recognize our leadership on, is because it does take some humility to say, hey, we're gonna bring patients in, give them a seat at the table, and listen to what they have to say, and be willing to go make changes. And we're going to be willing to admit that we are not we are not perfect, and I loved it. I love that mentality. Those that have been on the committee have really embraced it, and we don't have anybody on there that's tearing us down. They share the truth with us if it's something, they have no problem telling us the truth, but they're also saying we want to make this better. Here's how we could do it, and they share the good and everything in between.
And they've had great suggestions. So
great.
I mentioned earlier the use of My Chart. Well, one of our members, Trayvon, said, hey, what about, can we use the volunteers within the hospital? Can they help us, be kind of at the bedside to help patients when they're here or in the clinic setting as well, or waiting areas, so that not only do they have their instructions of how to use it, they can show them real time, and if they're troubleshooting real time. So that's something we're looking into. And back to your comment about leadership, everything the committee's brought forward, we've been able to either implement or take forward to leadership if it's going to take some more resources and some more coordination. And they've been very supportive. So that is definitely key. And so when the members see us making changes based on what they suggest, then they keep bringing more. So it's been great. But we try to be really intentional to make sure we had the majority of our communities are representative. Everyone doesn't live in Wichita Falls. We have a great couple that lives in Windthorst, with people from just different areas in our surrounding communities that sit on the council. And so I think that's been helpful as well. You're just not getting from one area. You're getting from, because it's different to access care when you're down the street versus when you need to come in from, 30, 40 miles or even further. So lots of opportunity, but it's been I think we implemented in August, and we have done quite a few things that have been really beneficial to both staff and for our patients. Yeah,
I mean, it's very powerful when you hear from them, get these ideas and suggestions, and then go knock them out. And some of it, it's interesting because I've been, I'm not at 36 years, but I'm getting pretty close to 20. And, you just start to think like a healthcare person. You try not to, but this is the lens that I have lived my life through, is working in healthcare. And I can't unknow what I know. And I can try to put myself, in a person who's never worked in healthcare shoes, but I just can't, because I don't know. And so some of the things that they pointed out were so simple, things I would have never thought of. I could have sat and thought and worked and asked AI and never come up with it on day one. They're like, hey, has anybody thought about, what happens at this desk? And this is how we feel when we walk up to this spot.
And we had no idea.
And we're going, we had no idea.
We come to that desk from because we work there, we're coming from a different direction. We know that the people who work back there, it's completely different experience. So that was,
it was an easy fix,
quickly fixed.
It was like this one phone call, to fix this one simple thing, but it came from giving the patients a seat at the table, right? To say, we want to hear what you have to say. What are the things that are going well for you, that you appreciate, that you feel, seen and heard? And then where are the places that you're not? Where are the, where's the friction? Where's the things that irritate you and cause you to not want to use us, and those things, many of those things are just totally fixable. We just had to know. If we don't know about it, you can't fix it.
Yeah, we didn't know.
So that's been incredible. So what are you excited about coming up? And we're just scratching the surface with this Family Advisory Council. We've got it up and off the ground, but I'm excited about where we're going. What's got you fired up?
I think we've got several opportunities. Some of the topics that we're going to cover in the upcoming months are like our discharge process. We have a discharge process in place that we think is great as the hospital, but what do the patients and families truly think? Like, we have great folders, we have great handouts, But when you are sick and it's time for you to go home, you're not at your best. So we need to hear from the patient and the family's perspective about our discharge process and when is it appropriate to go home versus when they may need some additional resources. And then with some of our new construction with our nursery and our new imaging building, we want to take the patient family advisory council over there so they can see it, maybe get like the first look. It's so important that they're part of all of these processes. They are truly part of our team now. Yeah. And I mean, there's so many things we can work on, but we want to start with some things that we think are really impactful to patient care and to patient access of care.
Yeah. I love that. I'm excited about that. And I know we're even exploring the idea of some other councils, that may be a little more specialized. Right now, it's just a general council. Is there any other of those that you kind of have in mind that you're thinking on?
Yes, so we definitely have an opportunity for our Spanish-speaking patients and their families to understand their needs. We want to meet their needs, but we don't know what they are until we ask. So that's definitely an opportunity. And we've even heard talk of maybe having something specifically for our women's and children's, and then maybe even something for cardiology. I think it's endless what we can do. We just want to make sure that it's meaningful and that we have the right people. So, but definitely, I think a priority is that having something for our Spanish-speaking families.
Man, I'm so excited about that one. Last year we did a lot of work around our Spanish speaking, or non-English speaking specifically, but for us that's primarily Spanish, although there's some others. But when we first started doing that work, we did just one focus group. We had a third party, NRC is our vendor. They did a focus group early on, and I had looked at, hundreds of thousands of compilations of data at this point, and 1 hour with about 10 folks who were Spanish speaking or had a family member in the hospital Spanish speaking. I learned more in that 1 hour, and that informed what we did over the next year more than anything else we could have done. Within the first 5 minutes, I kind of had the same aha. I'm like, oh, well,
there's so valuable.
I'm like, oh my goodness, this is what they're facing. This is fixable. And then we were able to put multiple things in place within a short period of time, and we saw massive improvement. And now there's still work to do, of course, but we saw significant improvement that we're proud of, and how our Spanish-speaking patients were scoring us on our communication. That went up significantly just from a few patients telling us, hey, let us listen to you for a few minutes,
But because from their perspective, like they were having difficulty understanding the discharge information.
Yeah, that's a great one.
Or follow up with their physicians. Yeah. So it's so important for their health that we get that communication correct.
I can't, on our previous shameless plug last podcast episode, it's not even out yet, but it will be, but by the time this one comes out with Emily, ended up in a hospital in Mexico. And that's where it's a wild story where she found out she had a brain tumor, and she was dealing with not only the horror of, hey, you may have brain cancer, but not understanding the team, speaking a different language. And so she was empathizing with what that must feel like to be in healthcare, such a vulnerable place, and then to speak a different language at such complexity. And so there were so many things we thought we were doing. We thought we were using our translation devices and all these things appropriately, and we found out we were not, and that we were able to start to mitigate that. So I'm very excited. I know what we were able to do just with visiting with one set of patients for an hour. I'm excited with what we can do if we had another committee focused of Spanish-speaking patients or their families focused on that. I think that's going to drive some incredible improvement. Yeah,
definitely.
Some big things.
Another thing we were able to do is at one of our meetings, we had some of the leadership from Shepherd Air Force Base attend, and they were having trouble getting their committee up and going. And so we just shared some of our, like I said, we're brand new at it, so just shared some of our practices. And so next month, we're going to attend their meeting and to try to help continue to support that. They had 20 people that came to their last one. So that's going to be a great partnership as well. It's like, a completely different group of people that can give us a different perspective. Yeah. So,
and a lot of crossover there between our committee and their committee, and those.
They want the my chart information. They want the information about falls. They want the information about services that we have available. So there is a lot of crossover.
Fantastic. Well, thank you, Shelley, for all the work you're doing on this advisory council. I got a call early last year from my leadership, and they said, "Hey, this is something we talked about long ago. You and I have had this conversation years ago, and it just one of the things that just never we experimented with a little bit, but it never really took off." And so, anyways, I got a phone call that said, "Hey, we want to circle back around to this idea of a patient family advisory council. We want you to be involved." I was like, "Yeah, absolutely. I'll be involved." But it was a little bit of nervousness in the back of my mind of like, we've tried this before. And then they said the magic words. They said, "You're going to be co-chairing with Shelley Moser." And I was like, good to go. We got this. As soon as you were my security blanket of like, we're going to be good. So you have just outdone yourself with this committee. Truly, I'm not just saying that. This is not a paid ad. I don't work for Shelley.
Well, and I definitely want to give credit. We have a great quality team and they organize it. They set it up. They make it work.
Truly.
They're
truly.
awesome.
Yeah, that team, you got an incredible team, but you built that, you built that team, you built that culture, and you guys have a really good thing going there. I'm excited about what's to come. Anything, moving off of Patient Family Advisory Council, is there anything that we haven't talked about today that you wanted to be sure and cover or get out there, things that you would want folks to know before we wrap up?
So I did give that some thought, and there's so many different things to talk about. But under our new leadership, one of our core values is excellence, and excellence is so important for everyone, right? So we want to have an excellent patient experience. We want to have an excellent culture for our physicians and our staff to work in. And I just can't say enough about we have a great team, and we. I think sometimes that gets lost in all the things because it's busy, it's 24/7. But we have an amazing team. We have great equipment. We have great technology. And so we do truly care about it. Every patient that walks in our facility or rolls in our facility. And we want to provide the very best care. Are we perfect? No. But we will try to correct anything that we can and make sure that doesn't happen again. But it's not only about our patients and our community, but about our staff as well. They are vital to making all of these things work.
Yeah, absolutely. I think that is well said, and I couldn't have said it better myself. And I'm excited for the future. Excited to work on it with you. Thank you for coming on and for all you do.